This is an Eye on Annapolis bonus podcast.
Joining us on the phone again, as he did a couple months ago, is Dr. Michael Freedman from Evolve Direct Care right on Forest Drive. How are you today?
I am just lovely, John. Thank you for asking.
Do you have a turkey in the oven already?
Not quite yet.
No. I'm not sure. I think this will probably get out before Thanksgiving, but if it doesn't, it will be within a day or so. But we wanted to touch base with you because you are our resident medical expert on COVID, of what else we've been talking about all year. I know we've talked about flu in the past, but COVID is really sort of taken everything. And I've had 3 tests so far. All of them have come back negative, so I'm going to knock on wood on that.
Yeah, I'm knocking over here.
Yeah. But, you know, what are you seeing in your practice? I mean, at this point, we know that the numbers are going up. We know that the politicians are all sweating profusely. It doesn't look good here in Anne Arundel County, here in the state of Maryland, here on the East Coast, here in the United States. It just looks, it does not look good. So what are you seeing in your practice?
Yeah, so up to this time, COVID has been a little bit of a distant issue. It's been, of course, overwhelming the practice, but the vast majority of our tests had been negative in the past, and most of the COVID cases that we followed were folks that had been in the hospital or kind of at arm's length. And now we're just seeing a very different picture that correlates, with the statistics coming out of the Maryland Department of Health. But, instead of hearing about it or having a few cases rarely, it's becoming very common that we have a number of positives per day. And we're starting to see a lot of tragic circumstances where someone tests positive and they've been around a bunch of other people and they all end up testing positive. And it's just, you read about it in the newspaper that the spread is rampant in our community. But when you start to experience it firsthand, it definitely feels different and a little more frightening.
Well, I'll tell you, I know that, for Thanksgiving, in a normal year, I probably would have gone over to my girlfriend's house and the kids would have all been there and everything else. And this year, not doing that. It's we realized that even though it would be a small gathering and certainly under the legal definition of a gathering, whatever that is made at this point, but we're bringing in 6 households between, the kids at college and living in apartments in different towns and everything else. And it's bringing in 6 households. And we just figured, anybody would feel like crap if we were responsible for, passing that on to anybody, regardless of what the final outcome would be. I mean, I don't think anybody here in our group anyhow has any kind of underlying conditions that would put them at exceptional risk. But still, it's not something that, looks strictly for old people with underlying conditions. I mean, this can affect everybody. I mean, we've seen students come out of schools with it. We've seen, young, old, black, white, male, female. It doesn't really matter.
Yeah.
I mean,
let me just comment before we move on from that statement. It's really interesting because we don't yet understand who is at risk for having a bad outcome with COVID. We know that if you're older, the older you get, the higher risk you are. But I have to tell you, we've had some people in their 80s and 90s get COVID, do okay, and go back home. So that happens. And at the same time, though, there's other people that are in their 30s, 40s, 50s, and occasionally the teens and early 20s that end up dying from it. They're not necessarily people who have a suppressed immune system or have some other underlying problem. It's, at least to our current way of looking at it, it appears to be like a crapshoot. And there was always this analogy, Linus Pauling, Nobel Prize winner, I think it was chemistry, but he used to have this analogy of you've got this auditorium and you've got a high-powered rifle. The lights are off, and somewhere in there are your family members, and you have to just fire this rifle into the audience. And there's maybe 3 chairs are occupied, or 2 chairs, or 1 chair. Who knows? The question is, do you feel comfortable pulling that trigger? And the chances that you might hit them fairly low, but good Lord, you'd have to you'd have to put a gun to my head to pull that trigger. I just wouldn't want to be the person doing it.
That's a horrible analogy. I mean, it's very shocking, but it's a good one, but it's a horrible one to sit there and think to be put in a position where you've got to think about something like that. And unfortunately, that's where we all are, I think, right?
That's Thanksgiving this year and the holidays coming up. That is exactly what we're looking at, that, these folks coming in from college and anybody, because it really could be anybody, comes in and, you end up with a house full of people that get COVID. Well, if it's just you have a flu-like illness, then not so bad. But, if you end up dying from it and the mortality from it is still, dramatically higher than flu, you're just going to feel awful. The last thing I want to be doing is telling people don't have Thanksgiving, don't have the holidays, don't get together like this. But, we are in a really dangerous position right now.
The one thing that I do appreciate and like about you is that you're coming into this without an agenda. As far as I know, you're not looking at a presidential run in 2024. You're not looking at a second term as county executive in 2022. You're not a medical equipment salesman looking to, put ventilators in the hospital, and you're not an ICU ER doc that's looking for drum up business here. This is something that's sort of been thrust upon you in your practice, just as it has everybody else in the country. And, you've just got the expertise to be able to sort of sift through it. And that's really what I certainly appreciate what you have. I mean, I realize that you're not an epidemiologist. That was the word I was looking for. But you've got enough education, enough knowledge to really opine on this. And you look at our own health officer, Dr. Colin Arman. I mean, he is also not an epidemiologist, but he's doing a fairly good job for us.
Definitely.
So far. And we hear all these different things. They've changed it up now. The metric of the day seems to be the cases per 100,000 population. Is that the best metric to look at, or is it? I mean, I know at one point it was positivity, and then deaths and new cases and everything else. But what should we really be looking at?
I think the most important thing to look at is my primary source of data is StatNews, COVID Stat News, and they have a tracker which you can set at a 2-week trend, a 1-week trend, 5-day, 1 day, and you can take a look at that, and you will see Maryland is up 95.7% compared to 2 weeks ago, and compared to 1 month ago, we're up 150%, and the line that it's drawing is now like double where it was at the peak of the surge, back in the spring. To me, the fact that curve is going straight up, we've hit this exponential growth. That is the most important metric to me, seeing that number going up that fast.
And is that COVID Stat News? Is that your best thing? And that was one of the questions I wanted to ask you, is for the numbers geeks and the data nerds and everything else that may be listening, myself included. I mean, I look at the Hopkins dashboard, every morning. I look at the Maryland dashboard every morning, and I don't know whether those are the two best ones to look at or not. And that was one of the questions. But COVID Stat News? Yeah,
I like COVID Stat News because you can interact with it a little bit more and see trend over time. Maryland Department of Health page is also nice because it will tell you what's happened in the last 24 hours and what the totals are, but the data is not as interactive. Hopkins, for a long time, that was the primary dashboard that I kept up with, but I've subsequently switched over as far as monitoring the trends because I think the StatNews is getting good, solid data, and you can manipulate it in a way that is a lot more useful.
We've got a vaccine, knocking on wood again, that is around the corner. We're not quite sure how big the corner is, but we've got 2 of them, I believe, at this point that have been pretty much green-lighted to start production within weeks. But we're looking at vaccinating 300 million plus people, which is a huge task. And I believe these are the only manufacturers that are doing it worldwide. So, I mean, we're looking at a worldwide distribution as opposed to just the United States, despite that we're the largest one. Am I correct in there?
Yeah, no, it's not 300 million. It's 8 billion.
Right.
Now, arguably, we'll have a little more pull than, some of the billions. Again, the problem is it's going to take a long time to ramp up how many vaccines are available. So, the first grouping of vaccines will go to the frontline workers in the hospital, the emergency rooms, the ICUs, the paramedics, people that are interacting all the time, police, teachers, and by the time it's available for the general public we're still looking at April, May, maybe earliest March, I think, when it's rolling out for everyone.
Right. Well, that's and again, the other issue that I find, and I'm personally not very comfortable jumping into the front of that line when it becomes available. I mean, if April or May rolls and you send me, your patient email saying, "Hey, John, come on down. We got a COVID shot for you." I'm not sure that I'm doing that until I'm starting to hear a little bit more of what this is. I mean, we're talking 30, 40,000 people have already had it, which is a fairly reasonable sample as far as I'm concerned. But there are just so many different little things that can tweak things off that I would almost hesitate to do that. And I know that they said that only 30% or 40% of the United States does the flu vaccine.
Well, I think when the COVID vaccine is proven to be effective and proven to be safe, and I'm going to put some asterisks next to those provens and come back to it, but I think when it's proven to be safe and effective, because of just how traumatized everyone has been with this and how deadly it is, I think that there's going to be a better uptake than with the flu. And of course, that's dependent somewhat on, if people are, playing political games with it or not. But as far as safety measures, you're spot on. I would not recommend being one of the first people to get it, because unless you're in a setting where your risk of dying from COVID is so high, such as being an ICU nurse or ER paramedic or something like that, then I think that it's best to not be one of those first people. Because even if you tested in 30, 50, 100,000, you may only have a side effect that could be paralyzing or something at 1 in 100,000 that suddenly, when 300 million people are getting it, it's happening all the time.
Well, I know we're sitting here looking at, we know so much more about the virus today than we did in March of 2020. And I remember when it first came out, I mean, the big push was ventilators. This was attacking the respiratory systems. We need to make sure that people are continuing to breathe. And now I'm reading and hearing that yes, certainly it does, but it also may have a pulmonary issue. Is that the right word for heart? No,
cardiac
issues, and it may have the sense of smell, the olfactory issues. Boy, there's a medical term for you. And we're learning more about it. And I mean, you don't hear about people going into the hospital and needing the ventilators and the shortage of the ventilators. Part of that is because we've been able to make so many more, and people are pretty stocked up with it, I think. But I think also the way the disease is progressing or affecting different people. And as you pointed out, that, you've got some 80, 90-year-old people that just, okay, I had a couple sniffles for a week and I'm good. And a teen that's hospitalized for 3 weeks.
Yeah.
So it's kind of crazy there. What advice do you give? I mean, what can we do as people just walking down the street? I mean, we hear the 3 W's: wash your hands, watch your distance, and wear your masks. Or as the governor says, wear the damn masks. Right. But I mean, is there anything else that we can do about that? I mean, we're going into the holidays. Thanksgiving pretty much sucks for a lot of people, for most people. Do we expect that to suck equally for Christmas and New Year's? What can we do day to day to stop this or slow this down, or just to make sure that we're safer?
Yeah, I think the toughest thing about it is, and anyone who's ever run a marathon or done an Ironman or, really, been competitive in something, is that sometimes it's a matter of like digging deep and pulling out, when just feel like you've hit the wall. And as a country, we've hit the wall with COVID. We've all had it. We're all tired of the damn mask. We've all got COVID fatigue. But I think number one is we need to really dig deep and, find that strength. Maybe, to me, I look to the great generation and, getting through the Spanish influenza, 1918, 1919, and getting through World War II. And I mean, they went through a lot. And I think, my goal personally and for my patients is, I'd like to try to get through this experience, recognize that it's a period of time that is hopefully going to be a year and a half at the most, and it will be a small blip in the whole of our lives. And I want to try to get through this knowing that I did everything the best way that could be done. As far as prevention or awakening that feeling in you, as we approach roughly 3,000 deaths a day, that number is kind of magic, not magic, but it's a special number because that's how many people died at 9/11. So, you imagine those two World Trade Centers coming down after these planes hit them and the way that we felt as a nation. And that's happening every single day.
That's one analogy that I looked at. I said, this is I can't remember what point it was, but a couple of weeks ago, I said, this is like 8 planes crashing every day.
Yeah.
And nobody's surviving.
Right.
Yeah, Boeing tries to pull that and we'll be, we'll see, but I mean, we're right on top of that. But,
yeah.
But this is not, it's not here. I mean, it's huge. The number is huge to be able to see that. And I mean, I know right here in Anne Arundel County, we've got 280 some odd people, I believe it is, that have died over less. And we're just a very small county of 500,000 people. It's significant. I wish more people would be a little bit more proactive. The mask is irritating. I did talk with a friend of mine whose grandmother is 103 years old. She's losing her hearing, and that's about it. She's not crazy or loopy or Alzheimer's or anything like that, and she's still living on her own, and her sight's going a little bit. But she said, I was born in 1918 or 1917, and damn it all, I'm going to see this through. And I'm like, yeah. And here's, as I thought about that, I said, here's a woman that lived, I wouldn't say she experienced, but that, the 1918 flu that we had. I mean, she's been through 2 world wars. She's been through, terror. She's been, she's seen, cars and internet and indoor plumbing and phones and, all sorts of crazy things. Mm-hmm. And the sacrifices that those that came before us are really significant compared to what we're being asked to do at this point. Wearing this mask, I hate it. I mean, I always forget it when I go into a store. I get in my car, I get to the front door and go, oh man, I got to walk back to the car and get my mask and do it. It's uncomfortable, but if we do it for a little bit, it will help. And, and we just.
No, and staying home, like we view this as this nightmare, but, we've got Hulu and Amazon Prime and Netflix. I don't mean to be glib about it because it is a sacrifice and it is driving a lot of people crazy, kids at home and all that. And the economic impact, especially on small businesses, is absolutely devastating. But again, the idea of either dying yourself or causing the death of, someone in your family is just really, to me, trumps everything else. It's just unacceptable
I agree.
To put people at risk.
I agree. Maryland is now participating with the COVID Alert app, and it's got a fancier name on that. What are your thoughts on that?
Fantastic. Very private. That creates this series of numbers that is scrambled every 10 to 15 minutes, and it uses this near Bluetooth that's very low energy, so that if you are within 6 feet of someone for more than 15 minutes and they test positive, you'll hear about it. And so I would definitely encourage people to make sure that's activated. I think Android users have to download it, and iPhone, iOS users, it's on your phone. You just have to activate it.
And I think it's a great idea, though. I mean, if I'm hanging out with you in your office and all of a sudden, one of your patients had tested positive, you would get the alert, and then, it's sort of automated contact tracing to a degree.
Yeah,
and
very much so.
And there is no cost. It is anonymous. You don't know who exposed you. You just know that you were exposed potentially at some point within the last 2 weeks or whatever it may have been. But yeah, get the app. You can do that. You can turn that on if you have an Apple phone. Just go into the general settings and it's down there under COVID notification. And then Android, you can download that from the App Store and get that. I'm a fan of it. Knock on wood again, my phone has not gone off and alerted me yet. So that's a good thing. One thing before we go, Dr. Freedman, is you are, I don't want to say you're the governor, but if you had the complete power right now to put whatever, regardless of ramifications, whether they be economic or social, societal, or whatever it may be, what would you say to do right now to kick this thing in the ass?
Well, it's there's nothing special I'm not going to share with you anything that isn't known by every scientist in the world, certainly the United States. There was a 400-page playbook put together for dealing with this pandemic. We are 50, 60 years overdue for this. So a lot of us have been just knowing this was going to happen, and year after year, we've been waiting for it to happen. And there's a very, very clear, extremely well thought out playbook as to what to do. And unfortunately, we are headed towards a lockdown, as much as I hate to say it. And I feel terrible for Governor Hogan that, politically he's, in this position because there's so much pushback to doing the right thing. But if you look at New Zealand, if you look at South Korea, if you look at any of the other countries, they have had tremendous success with doing an initial lockdown. And a lot of countries are going to this now, the UK, a lot of places, a 28-day lockdown. Once you get the level low enough and you have your contact tracers in place and enough testing, you can go about your daily lives. And as soon as someone gets it, you trace it down and you stop it cold in its tracks. And the death rates for South Korea, New Zealand, all these places that have done a good job are so much lower than ours. You might remember at first they said 60 to 100,000 deaths. Well, if we had followed what we were supposed to be doing and been good about it, that's where we'd be. And now we're looking at, potentially 400,000 by the end of January. It's just, it's abysmal.
Do you feel that number is a legitimate number? Right now in the United States, we're looking at 257,000 deaths so far. So you think within 2 months that number is going to not quite double, but 1.5?
Yeah. Again, I'm not so narcissistic that I think I know something better than, the average person. This is what most of the COVID projection models are looking at. Even if we really tamp things down, we're still looking at, probably around the upper 300s deaths, but, potentially as high as 500,000 by January 31st. And people don't understand. I can't get my mind around exponential growth. When something is doubling every day, which we're not at that quite yet, but if you have something doubling every day, that's like your kid comes to you and says, pay me a penny a day. This is the classic example. Right. Pay me a penny a day for allowance on the first of the month. The second, you give me 2 cents. The third, you give me 4 cents. And then at the end of the month, I forget what the number is, but it's like $15 billion a day. So it's just, it goes up so fast. So it's really terrifying.
Well, I think I tend to agree with you. I spoke with a couple different business owners earlier today, and honestly, they thought that there was a lockdown coming yesterday. I figured that he might announce it and make it happen on Friday, get through Halloween, get through Thanksgiving, and do that. And I get it from a political aspect that, you need to keep this economy open. You're coming into a critical period of time for anybody that's in the retail business. But the virus doesn't care. It's all, what is it? It's all out of F's to give. I mean, it's just going to steamroll through, and at the cost of losing, 500,000 Americans is just crazy.
And even if you take it outside of those, numbers, which are they're really hard to grasp, and even, for me to appreciate what that really means. But, if it comes down to losing someone in your family, when you're getting to those kind of numbers, you're probably going to. And it's just something that most of us don't want to do and don't want to risk. There's a really wonderful app that I would recommend to all the listeners. From Brown. I don't remember offhand what the website is, but if you go to Brown Medical School, or if you just Googling COVID risk calculator, or if you go to our website, www.emcforme.com, and then click on the COVID info link.
So hopefully we'll figure out what we're doing, and I appreciate your time, your honesty, and your advice, as always.
Always a pleasure, John.
All right. You have a great Thanksgiving with you and your family, and we will touch base probably a little bit later.
Sounds good. Be safe.
Take care. You too. Bye-bye.
All right. Bye.
This has been a bonus podcast from Ion Annapolis. Please visit us at ionannapolis.net. Follow us on Facebook at All Annapolis and on Twitter at Ion Annapolis. And if you haven't subscribed to the Daily News Brief podcast, go for it. And all of your local news will be delivered to your phone, tablet, or smart device by 6 a.m. every Monday through Friday.